Well, good morning, everyone. This is Knox County Commissioners on June 5th, 2025. Our first order of business is to do a salt brine hearing for B&J Drilling Company Incorporated. On this hearing, we have people from the health department that had decided to show up for the brine hearing. I assume that's why you're here, right?
I just do what Penny tells me to do. She's really here at 10:05.
Yeah, so we're signing in the for those for the salt brine hearing. If there's any discussion that needs to be done, that's the purpose of this hearing. And Barry and Trenda, do you have anything you want to say about the BJ's drilling company salt brine? Are you good?
I'm good. I'm good.
Okay, so we will conclude this hearing at this point and continue to move on with the Knox Public Health Report for June 5th. And I've asked Andrew to be able to do a split screen so that you won't have to do this from memory, Zach. So
You can,
for you,
man.
he can do it from memory, yes. So thank you for being here for that. I was looking at those the stats that I'm sure you're going to go over in 9 pages of it. Uh, so Zach, if you want to start out,
Sure.
say who you are and introduce David.
Absolutely. Good morning, Commissioner Zach Green, Knox Public Health Commissioner. With me today, I have Mr. David Hatley. Mr. Hatley is our agency epidemiologist. He'll be with the agency. Wow, it'll be what, 3 years this fall. He's a Knox County native and actually was placed within Knox County through CDC throughout the duration of the pandemic. And we were fortunate enough to retain David through his contract with CDC. So definitely a great asset, especially as we've navigated the most recent outbreak of measles, and we'll get into that momentarily. But before we go any further into this PowerPoint, just a few quick updates on my end. Environmental health, busy season for our team out in fairs, festivals, doing all the inspections that are necessary. We have started mosquito surveillance with traps to determine if any areas are potential concern. So we will spray those areas in the event that we do get a positive result or several positive results for that matter. It's something in the past that we've always done is kind of drive around and spray. We've changed our tactic to do more surveillance aspect and be able to collect samples of any pockets of the county that may be more prevalent to carry West Nile, and then we'll spray those areas accordingly. We're also looking to change platforms for our sanitarians that are going out into the community doing inspections. EHGov is one of the newer platforms that some of the health districts across the state have jumped onto. There is a state platform, it's called Cella, that is being sought out by High Department of Health.
It's called Stella or Cella?
Cella, ACCELA, I believe. I'm just gonna be frank on the record, like I always am. It's been a conversation for 5 years, has not come to fruition. It really is not user friendly at this point, and we need to be efficient in the field. And what we're doing right now is not efficient. And it was all just because, hey, we got this platform coming. Hey, we got this platform coming. Well, I don't want to spend money if State of Ohio is providing this. We're done waiting, and we're launching this program and getting that out into our field. So again, as always, questions, please let me know. But that was a decision that frankly took too long to make, and we pulled the trigger this year. Dr. Brian Barquette, psychologist out of Granville. I believe maybe I've talked to you guys a little bit about Brian. He has been now 2 days a week at our 206 South Mulberry Street, focusing on EMDR and neurofeedback for our first responders. It is a grant that is provided through Knox and Licking County. Our MHR, Mental Health and Recovery Board. So it is subsidized for our first responders to be able to ensure they get proper treatment following traumatic events in their life and or what their professional career puts them into. So I'm excited to see Brian in our community. It definitely alleviates the fact of our professionals out in the community having to travel to Granville, get them here locally and be able to start breaking some of that stigma and type A personalities. So with that, we are outside of our measles outbreak. Fortunately, that's a good news. We will continue to monitor that, obviously with the busy season of travels, weddings, etc., large gatherings of that nature. Still trying to create opportunities and access to MMR for the vaccine to mitigate the ongoing threat of contracting measles. And with the federal government cuts, the state of Ohio wastewater surveillance program has been impacted. And at a local level, what does that mean? Mount Vernon is the only water district at this point that is online for us in Knox County. So we lost Jellaway, we also lost Gambier. And David informed me before we came here today that with those cuts, Ohio Department of Health has lost staffing in that program. And we are not currently getting any of our surveillance for Mount Vernon. It's online, but we're not getting up-to-date information, which is highly unfortunate. This is a tool in particular for proactive measures in prevention that's going away. And if anything, one of the major silver linings coming out of a pandemic was the surveillance piece is up and coming. It's huge. So it's unfortunate, but the good news is Mount Vernon's still online. Hopefully we can start getting some of those reports in the near future, but Dave informed me that there's no timeline at this point. So
Is it all funding?
that would be, yeah, it was a funding mechanism, which, you know, at the end of the day, we'll take whatever we can get, right? And the fact that Mount Vernon, the largest per capita in our community, is online, we at least have some type of an epidemiological response. But you're still taking away data sets that could be a problem. So with that, Mr. Hadley, I'm going to turn it over to you, sir.
Quick question.
Yes, sir.
So on the spraying, are you guys using drones at all? Or are you doing a back of the truck spraying for, you know, mosquitoes and say, hey, get inside, here comes the mister for the mosquitoes?
Quit playing kickball in the street.
Yeah, so the drone's actually an interesting conversation. That would be fun. Do you guys have funding for that?
I don't have funding for it, but I know some of the farmers are doing that to spray their crops.
Sure. Yeah, no, none in which, that's interesting. I was curious what that looks like for our pesticide to be able to get that out there. No, it's in the back. Yeah.
Like it could have
in the back of
dangers
the
with
truck.
it.
No different than what, I mean, that's the mechanism we had to be
Okay.
able to deploy that. Again, it's based off surveillance and being able to have positive. Unless we get a call from township and or municipality saying, hey, we got really bad area, community members are asking for that, you know, we'll go out and spray for them. But it's, yeah, trying to hit the impacted areas rather than just wild guess, right? But I need to look into drones, Mr. Purcell.
Yeah.
I mean, might need to take a field trip with that.
Yeah.
I know a couple of the farmers down in Danville, Howard area are using drones
Yeah.
to do their crops.
Yeah.
Tim Norris is doing it. So.
Wow. We'll talk offline. I'd be curious of what they can actually carry. You would think they wouldn't be able to spray as much.
Yeah.
Right?
Yeah.
So anyway.
Be more precise though, I would think. Than a plane flying down, you know.
Yeah. Well, yeah, mosquito surveillance, you don't really know what target necessarily you're hitting. You're just hitting a larger area rather than a specific.
Wouldn't it be more cost effective and efficient to have the bats be increased population wise and then take them someplace else? Have them.
I love bats. As long as we can keep bats around, that pays dividends for all of us. Absolutely.
Better than poisonous chemicals.
Yeah, that's fair.
Okay.
Yeah,
Mr. Hadley.
yeah. Before we get into this real quick, just in addition to your wastewater,
Mhm.
What that looks like on my end, when Zach says that, Mount Vernon is still online, they report the data to, or they send the water samples to ODH, and then ODH sends us back an alert if that's high. And so when they do that, that puts us about 2 weeks behind, by the time we get those alerts. What they were doing previously is they were giving us the raw data instantly. And then we were able to take that and, you know, use it immediately to monitor wastewater trends. So just what that looked like on my end. Perfect. Yeah. Next slide, please.
There we go.
Yes, this is the agenda I have for this, just quick PowerPoint. nothing too in-depth. I just want to cover Lyme disease, the measles outbreak we just went through, and then vaccination rates, since that kind of touches on the measles. So this is Knox County, kind of versus the state of Ohio as far as case rates. Lyme disease, we had 124 cases last year in 2024. You can see that's about 4 times, I think, what the Ohio rate is.
So I have a couple of
Why?
questions, not to interrupt you,
Yeah,
but
no, go ahead.
first
please.
off, I see one case of malaria. Was that actually in the county or is that somebody traveling that came back with the malaria? Cause you don't hear about malaria being prevalent in Knox County. So
Yeah, sure.
that was somebody traveling, I'm gonna
Yeah, yeah.
assume from somewhere, right?
Yeah, it was a travel related case.
And the second one I have for you is, I think you just touched on, if I look at your slide, Knox County is, I mean, just smoking everybody when it comes to Lyme disease.
Yeah.
But why the major from 2020, well, the 2020 to 2024, why such a big jump in Lyme disease in our area?
Yeah, so there's several reasons for that. One is that we're doing more advocacy in the community, where we're going into schools, we're talking about Lyme disease and ticks with kids. And so when they have a tick on them, they can immediately go to their parents or their doctor and say, hey, I had this tick, I have this weird rash. So part of it is that awareness aspect they have now, that they can advocate for why they feel ill. Secondly, we've also engaged doctors in the community to, discuss it with them so that they know what they're looking at. Cause they're, you get a rash, it could be a lot of things.
So are you saying that the uptick is from awareness more than anything from 2020?
I would say it's a combination. It's a combination, both, tick populations are increasing. And also with the awareness, people are, becoming more aware when they have a tick or when they feel ill after a tick bite. So it's a combination.
So what's the anaplasmosis?
It's another tick-borne disease. I don't think we typically have too many cases. As you can see, we had one in 2024.
Yeah.
I don't think we had any the year before that. But it's another tick-borne disease. The Rocky Mountain spotted fever is also a tick-borne disease. That's included in there because in 2023 we did have a case. So that's why that's included in the 2024.
Would other counties not also have awareness about Lyme disease? Because our numbers do seem so high compared to the rate. I guess those are cities though, and not so many wooded areas with wildlife and deer and that kind of thing
Sure.
in those numbers.
Yeah, sure. If you want to go to the next slide, I can kind of show what that looks like.
Okay.
So there in Knox County, you can see that we're quite high for the rate. And I'm not exactly sure which one of those counties is to the east of us. But this is our central
Yeah.
region. So some of those counties just don't have large health departments or health departments that are funding any kind of infectious disease information, so they don't investigate those cases, so they're not reported.
Because that would be Coshocton and Holmes, right?
Yeah,
But they'd be outside of our central region, so that's where you were, that was your scope, was central, right?
yeah, just the central region.
Okay.
So Licking is number 2,
Mhm.
which makes sense. They're next to us, but Fairfield, it does seem like there's a concentration between Knox, Licking and Fairfield.
Well, you would think Morrow because it's densely, it's not.
It's also, it's not that individuals aren't contracting Lyme in those counties.
They're just not reporting.
Yeah.
It's the reporting mechanism. It's identifying, are they getting on 21 days of doxycycline, right? And then it becomes a chronic illness because it's not being captured. And a lot of it really comes down to the educational component. But the tick population, especially black-legged deer ticks, are increasing. at a
And they're
rapid
smaller,
rate.
aren't they? They're smaller. They seem to be
They are
smaller.
extremely tight. And
Yeah,
even at
The black-legged ones are very small.
and even in the NIM stage, which is the pinpoint.
Yeah.
And they still, you still can crack on. Even that.
I noticed from being out and around that they're a lot smaller than I can remember. them being when I was a kid.
You just gotten so much bigger.
Yeah, there's
People-
several ways.
Place for it, but is there a preventative measure, or if someone sees that, what they should do immediately?
Yeah, Preventative measure, unfortunately, it really comes down to education, make sure you're checking yourself, making you're spraying yourself down, wearing long clothing,
Bright colored clothing.
bright clothes, so you can actually adapt.
Oh, yeah, okay.
A lot of individuals who contract Lyme won't even wear their bib because they are so tiny. So I don't want to act like, oh, you wear bright clothing, you're not going to get Lyme disease. I don't want to sell that short. But in the event that you are bitten by a tick and you have to, remove it, you can bring it into our office. We can identify the type of tick in itself. If it was within 72 hours, and I'm looking at you for confirmation on that, I believe it's 72 hours, they can receive 1 dose of doxy just as a preventative measure, to help mitigate the potential threat of.
That's an antibiotic, I take it.
That's correct.
Then you have to go to you or a physician to,
Any primary care. So,
okay.
yeah, wherever.
So there's nothing over the counter that, and do you get tested first for that?
Not for the 1 dose. That's more of just, hey, it's a prophylactic, just be able to say, hey,
Just,
it is a black-legged deer tick. It was attached. You took it off within 72 hours, right? And in 72 hours to receive that 1 dose. 1 dose is a heck of a lot better than jumping on a 14-day or 21-day. You're positive, right?
And if I'm not mistaken, the side or the longevity of some of the effects from Lyme disease can be years, is that correct?
It can be lifelong, it can be
Yeah.
chronic,
Yeah.
if it is not addressed in a timely manner, it is undetected. Yeah, it's no joke.
Yeah.
And a lot of individuals are under the assumption, well, I didn't get a bullseye rash. Would you say half of the cases do and the other half don't? I mean,
Less.
less, okay, so. Just because you don't have a bullseye rash, you may have flu-like symptoms, right? And it's like, and my doctor can't figure out what's going on. Have them run titers, check me for Lyme. Especially this time of year, it's huge. It's huge.
so to test you for Lyme, is that a blood draw or?
Yeah. Titers. But. Yes, 196.8, that sounds like a lot. For me, I take a step back and that is us creating awareness, going to townships. Bill, I just was at a township Monroe Monday night. And I can't tell you how many times I go and get the educational speech line. It floors me that someone's sitting there, not a trustee, and they're just like, oh yeah, I had that 2 years ago and they couldn't figure out what was wrong. Right? So yeah, we're capturing, but I want to know how many of these individuals truly are going undetected and or unreported. And that's the scary number for me.
Are there stats about, got bit once, got bit 2 years ago? I got bit again this year. Is there an accumulation effect of the Lyme disease? Getting it bit several times?
There's not, but obviously you would increase your odds of contracting Lyme disease for getting bit by a bunch of ticks every year.
Yeah.
But there's not like a compounding effect of.
Didn't know whether it was immunity type stuff that may build up because of that.
Unfortunately, I don't think there's any evidence that show that would be a blessing.
Yeah.
I mean, even with your pets, they have a vaccine for your dogs. You have to get that every 2 or 3 years, I believe.
Yeah, it's sad, but the reality of it is we know more about Lyme disease in canines than we do humans.
Really, that's interesting.
We can go to the next. So as we touched on, this is from 2020 to 2024. You can see the cases are increasing every year. Hopefully, the 2023 to 2024 could be a decrease because of awareness, because people are monitoring. Wouldn't be sold on that yet. Let's see what happens this year.
Yeah.
But
So if they get a tick, put it in a clear baggie, bring it to you guys.
Yeah, it's our main office in Upper Gilchrist, and we'll identify it. Thank you for saying that. We will identify the type of tick. We cannot test the tick if they are a carrier of any of these.
Okay.
Last I knew, no department and state has that capacity. Is that so accurate?
yeah,
She would just go ahead and administer the,
Right,
Okay.
yeah, depending on the type of tick. It could be American dog tick, right? And it's like, okay, just monitor yourself for symptoms, pursue that, but Black-legged deer ticks are, unfortunately, the vast majority of people getting bit right now, I would argue, are finding this black-legged deer tick. It's becoming predominant.
So going back to the bright colored clothing, is that so you can see the tick on your clothing, or is it actually
Repel
just
them.
get repelled?
Yeah, it does, I mean, we can make up a good story. It is just so you can.
You can actually identify a tick on your clothing, okay.
As long as you wear red, you won't get limed.
Yeah, well, there was an old thing in the military because the ticks were prevalent in some of the places that your chemical makeup attracted ticks and some other guys didn't have that chemical, so
Sure.
you didn't get it. I'm like, really, how do you get the
Eat
chemical?
lots of garlic.
Yeah. No, it's just so you could hopefully have a better chance of.
Right, yeah, that's what
crawling on you.
So a spray around the ankles helps to deter them?
That's what they say.
Yeah, yeah, a lot of hunters use it, it's,
Yeah, what is that?
permethrin is the chemical, it's not for your skin, it's not supposed to be sprayed on your skin. But you can treat your clothes with it and, take them all, spray them all down and everything, let them dry. And that's good for, I wanna say a couple months, quite a few washes.
Which does come in contact with your skin.
Yeah.
Clothing.
Yeah, it does. I wouldn't recommend spraying the inside of the clothes, just the outside. And your boots or shoes, that does a really good job. That's part of our advocacy is informing people about that as well. We can go to the next one. This is by month, so you can kind of see that May, June, July is where we see the most Lyme disease cases. Actually, we see more tick bites from black-legged ticks in July and August. The reason we see more cases from Lyme disease in May and June is because they're smaller than the nymphs, and people don't know that they got bit. So that's when they're hatching and they're first emerging.
And if you're not sure if you got bit, still get the drug or not?
If you're not sure, if you don't have a tick, then you're not gonna go get the drug. The doxycycline, but
Unless they run titers and then you
Yeah.
have Lyme disease, then you'll go on your regimen of doxy. You just won't get the one dose preventive, because you didn't know you were bit, right? I mean,
Well, I just saying, if I found a tick, put it in my baggie, take it to you and you say, yeah, this is that tick,
and
but I'm not sure if I got bit.
Mhm.
Do I take the shot anyway?
no,
Is it a shot or is it a liquid? Is it a
it's just a
pill?
pill form.
Okay.
Yeah. No, you're gonna know, because it's still gonna be embedded.
Okay,
Once they feed and they get engorged, they fall off. They don't just hang out on your body.
yeah,
Right, so if it's still crawling on you, it didn't feed.
okay.
Yeah.
Good to know.
and there are private labs that you can send the tick to have it tested. But it's really not recommended because a lot of black-legged ticks carry the Lyme bacteria, but it doesn't mean that you got it. So,
Okay.
it's not really something that.
This graph, well, no, not this one, but this one kind of amazes me because, years ago, you used to think that winter slowed down immensely or did away with them until the wet. Now it shows that they're prevalent pretty much 12
And
months out of the year.
that's the black-legged deer tick.
Yeah,
That's
12 months out of the
specific.
year.
Yeah, and that's why, it's because they're continually moving into our communities, and that's why now you're seeing it year round. To your point, 10 years ago,
Yeah.
dog tick is not active
Yeah.
through those winter months. It's not.
So this new breed of black leg tick is kind of a super morph of an insect.
Yeah.
Huh?
You spoke of spraying for mosquitoes. Are there any methods to eradicate ticks that Lyme?
Oh, no, not to eradicate
Right.
ticks, no. There's some different states that are trying different things, in particular to the deer population. And salt blocks for deer in particular, they're trying different methods of trying to, because that's their carrier, right? I mean, they latch onto them. People think, why didn't you go in the woods? How did you get a tick? Well, deer walk through your yard. That's, so the short answer to that is no, unfortunately. I don't know if we'll ever see a way to completely eradicate a vector like that.
Lessen them?
Yeah, no, I mean, there's some preventative stuff you can spray your yard with to assist with that. But it should not lessen your expectation of
you're fighting two battles really, because the deer population has gotten a lot larger over
That's what I was
so many
wondering, too.
years too. And now you've got the tick population, and of course it's growing with the deer population, so you're kind of fighting two enemies now.
Raise the hunting limit.
Yeah, there you go.
So if I do have deer come across my yard all the time, I need to put a salt block out that has the medicine in it to, kill the anti-ticks that might try to come across my yard.
I mean, you could try it. I'm happy to do a trial and error with you. I'm not sure if
Yeah.
it's gonna.
Is there funding for that?
Yeah, once you get my drones.
Okay.
Just to touch on what you said about it being year round,
Yeah.
from what I've read in the literature. You would need 2 weeks of about 15 degrees consecutive days for those ticks to die.
Yeah.
And you
So-
don't get that much anymore. I mean, not 2 weeks of, you know.
Yeah, and that's assuming that they're not actually.
2 weeks of what?
2 weeks of 2 weeks consecutively of temperature below 15 degrees.
Below 15.
Yeah. So when you say that though, 15 degrees on each day, or does it have to, the whole 2 weeks have to be 15 and below?
The whole 2 weeks.
Okay, so it's not just each day, gotta get below. To get.
Yep.
Yeah,
We're not gonna get that.
Yeah, I think that's it for the Lyme disease.
Enough for that, right?
Thought I included a map, but maybe I didn't.
You did.
Okay.
Or,
Oh, there it is. Okay. So this is, no, this is for vaccines. Oh, that's okay. It was just a map of Lyme disease, by county. And it showed it really moving, west from east to west. So you can see that, throughout that really wooded part of eastern Ohio, there's a lot more cases of Lyme disease. So this is our measles outbreak. We officially closed that on May 25th. April 13th was our last rash onset date. We had 23 locally acquired cases, one international case, and then one case that we weren't sure was a case, and then after testing wasn't. So a total of 25, 24 technically.
and so those cases are going to Knox Community Hospital and they're reporting to you, or they coming to you and you guys are, administering, medicine or whatever?
No, so our original case, contacted us and said that they had, measles. They had contact with people that had measles out of state. Then we contact him, did contact tracing throughout the other people, and then monitored them for the incubation period to see if any of them developed measles. Had them isolate in their homes so that they didn't spread it or anything. We did have a couple close calls, people going to the hospital, not sure if I have measles, I'm sick. And, don't go to the hospital.
Is this mostly an infant or a mixed adult and infant?
Yeah. Yeah, it was quite a few adults. I don't think I provided a case breakdown by age on there. But it was mostly adults. Everybody was unvaccinated.
Yeah, I was gonna say vaccinate or
Yeah.
not.
Incubation period is how long?
21 days.
And wow. It'd be tough to stay in your house for 21 days, not be out.
Yeah, so if you get measles, you actually only have to stay 4 days in your house.
That's the code.
Yeah.
We're not going down that way. You asked, like, do they have to go to the hospital? The team does so much, David and our epi response team does so much behind the scenes. That's why I wanted to bring David in and just go, hey, this is what we do day in, day out, that hopefully no one in the community knows about, because that means everything's contained. No, we would send nurses out, conduct testing. Dr. Rodway would go out, do assessments, provide medicine as needed out actually at their residence. I had 2 fire districts on standby for the kids in particular, if we need to transport to Akron, so they weren't walking into our ED and potentially impacting them. So, I mean, there's there's so much that goes into that to contain it when we have the ability and the other parties involved are open line of communication. And then we can actually do our best to be able to mitigate
So
an
is it
ongoing.
an airborne disease? Is that what you're saying, the measles? I mean, it's,
Yeah, for 2 hours, right?
Yeah. Measles is actually the most contagious disease we know of. It can stay in the air for 2 hours.
wow.
It actually aerosolizes, so like if you cough, it'll stay in the air after you leave. For that
So
amount of
imagine
time.
walking into an emergency department,
Yeah.
right? Yeah, and not only the individuals there now exposed, individuals coming in for that 120 minutes, maybe less, depending on airflow. It's a problem.
You mentioned you had 2 fire departments on standby, the squads or the actual fire department?
Squads.
Okay,
EMS rates.
okay, yeah,
Fire districts, I should say.
yes, okay, thank you.
But it's contained,
Yeah.
Right.
In Knox County.
right?
Yeah,
To the best of our, that's the
Okay.
caveat, and I want to make myself very clear. Knowingly, there's an element of knowingly, right? Individuals that may have active measles, and if they're not telling anyone, they're not letting it, they're not going to, if we don't know, we don't know, right? So to the best of our knowledge, based off of our investigations and ongoing discussions with those individuals in the community, we are outside of our outbreak.
Enlighten me a little bit. I haven't heard about measles since I was a kid.
Sure.
What do you get? Is it a respiratory thing? Is it a skin infection? What is it? I don't know.
Yeah, it's a respiratory disease. Rash, fever, encephalitis.
Mhm.
So that's the piece that I think is an opportunity for us to speak about. I don't know how many times I've heard over the last 3 months or so. Well, it's like chickenpox, right? We had measles party when we were growing up.
Yeah.
No, it's not chickenpox.
Right.
He just made a comment about encephalitis. That's swelling of the brain and fatality. Chickenpox, right? And I'm not saying you're going to get encephalitis if you contract measles. I'm saying that that's the threat. 1 out of every 1,000, I believe, was the ratio. Help me out there.
1 of every 4 people will be hospitalized that gets measles.
Sure.
1 of every 1,000 will die.
Wow.
That's what the stats are.
So if it wasn't for Dr. Broadway going out into these houses, we had 2 children that received care. They were on the brink of being hospitalized. She was able to address them and get them the meds necessary to ensure that, unfortunately, we got it to the position where they made them in, but if they wouldn't have received that care at their house, they would have been hospitalized and died.
so I assume when the doctor goes out there masked and
They wear-
hazmat type.
So they wear proper PPE, but they're also fully inoculated, right? So they're vaccinated. And that's hands down the most known effective vaccine that we have at our arsenal, right? And it's just
I
unfortunate
think
that we're
it's
still
interesting
talking about measles
because you're talking about a 21-day
incubation period.
incubational period. And if it's a child, adults have to work to maintain their living.
Sure.
So they're traveling into the community. So once a child has been diagnosed with that, is it too late for the parent to get the vaccination? They're killed. Okay,
So we vaccinated.
okay, perfect.
And if a person's vaccinated or been vaccinated, and they're exposed,
They do not have
they're
to
not
quarantine.
they're not a carrier then?
They are not quarantined. They move on with their life.
Okay,
Monitored for symptoms, right? Because it's not 100%, but it's
yeah.
yeah. I mean,
Interesting.
Yeah, when you think about that from a school child standpoint,
Yeah.
that's a ton of data.
yeah.
Yeah, I mean, it's in there a month. I mean, well, it's a month probably at school, 21 days. So
Sure.
take the weekend out.
And as contagious as it is, I mean, you're looking at a real big disaster. And it's-
Especially our child care centers.
Yeah, oh, yeah.
That's huge.
And then just to touch again, additionally on what Zach said about the team contacting people and trying to follow along to all the people you met or talked to or whose house you visited or visitors to your house. It really was a lot of work for our nursing team.
So I have to ask, was this measles outbreak specific to a certain part of Knox County, or was it everywhere? Was it?
It was concentrated in a certain part of the country.
Okay, you don't need to say more, that's why I asked.
So moving from measles to vaccines, this is the vaccination rates for each county in Ohio. Knox County ranks 78th out of 88. We have an 82.2% vaccination rate. You need a 92% vaccination rate minimum for measles, to keep measles from spreading in the community. So this is something that we know and we keep an eye on and we have to prepare for. Because we don't meet that threshold.
So when you say herd immunity, lost Knox County community at risk, I guess I'm not clarify that.
Herd immunity is lost. Because you need that 92%, so we're about 10% short for Knox community, so we don't have the community protection.
Okay.
Last year, or I'm sorry, 2023, we actually had a whooping cough outbreak as well.
Yeah.
So. Yeah, and I think our vaccination rate about 4 years ago was at 89%. So in the past few years, it's really dropped.
So if I get measles, someone gets measles, are they then not going to get it in the future? Or is it one of those things you still need to get the vaccine?
No, you won't get measles in the future if you get measles. But there is actually something called measles amnesia, which measles is such a devastating disease when you get it, that it kind of erases anything that you built up immunity towards. So if you got like colds or flus in the past, you no longer have immunity to those. It's pretty devastating on your immune system in that aspect.
It's kind of amazing to me because I see measles, mumps, rubella, chickenpox, polio. When Bill and I were children, you had to get vaccinated or you couldn't go to school.
History repeats itself, Barry.
Yeah,
I mean, we're going right back to this, and it's like,
well, I think now that the rights and maybe stuff have changed where you can't make them be vaccinated. But yeah, you weren't going to school if you weren't vaccinated when I was
The
young.
public did lose a lot of confidence, I think, in
100%.
vaccination over the COVID debacle.
no doubt in my mind.
Yeah.
And there's no secret behind that.
But I mean, those are names that you just don't hear that like prevalent as it used to be. Polio was kind of around when I was young. Yeah, it's interesting.
So is chicken pox the ones that are associated with shingles?
Yes.
Yes.
Okay, so if I've had chicken pox, will I not get shingles?
No, you still get.
You have the virus to be.
It's the opposite.
Now you can get the shingles because you have the chicken.
And actually, can the vaccination also make you susceptible to shingles and because the virus is introduced to your body for that immunity?
I've not heard that.
What'd you say, John? I'm sorry.
That could the chickenpox vaccination also make you more susceptible to shingles because it's been introduced to your body? I've heard that, but I don't know. I'm not a doctor.
I don't know any validity behind that.
Yeah, sure. I do know that if you get shingles, you are able to induce chickenpox in somebody. So this is vaccination rates. So if you have somebody with shingles who goes into a school with children, they could have a chickenpox outbreak in that school. So that's also an important portion of this.
Eligibility for shingles. 50 years of age? Is that?
Yes.
I think they just lowered it.
They just lowered it.
I think it was 55, now it's 50 or.
And we are seeing individuals on their 40s start to have shingles.
So are you able to develop a vaccine for shingles that's not so painful to get? Because I've had people say that the shingles vaccination is one of the most horrible experiences that they've had.
So I will tell you that I've heard the same, I'm not gonna hide behind that, but it's 24 hours of adverse event versus
It's a
shingles.
2-dose thing, right?
And then it's a
Yeah.
2-day series. I
I don't work in that industry.
Yeah, he's coughing out.
Chickenpox and measles only, right?
It's like I did my PowerPoint.
Yeah, I do chickenpox and measles.
But yeah, it is common to have adverse events following your initial dose.
Yeah.
Talk to anybody who has shingles and they will take that vaccine any day
I
of the
need to
week
get
before they
that.
take shingles.
Yeah.
Every time I go to the VA, they're like, you need to get a shingles shot. And I'm like, because I heard the same thing.
And there are no chickenpox outbreaks right now in your stuff, so, right?
Right.
Yeah, yeah, well, any other questions?
No, you guys did a great job. Thank you.
Yeah,
very
thank
much.
you so much.
Appreciate it.
Yeah,
Very informative for me anyway.
Yeah, well, that doesn't take much. does it?
Yeah, yeah. If you don't roll a marble across the
Yeah.
table, I'd have chased this guy.
Jim?
exactly. I'm looking into the things we discussed yesterday at the Knox County Health Planning Partnership meetings.
Thank you.
I'll
for
get
being
back
there.
to you and
Appreciate
let you know. So thank you so much.
Otherwise, great seeing you guys.
Good to
Yeah,
see you.
any
Thank you.
future,
Yeah. If you guys have any follow-up questions, please, keep up.
make sure that we only give Zach 15 minutes.
That's
Because
fine. You guys
because of
just
his
don't-
insight into the.
Yeah, I finished the PowerPoint was 10 minutes and we ate up another 30 after.
All right, well,
Yeah.
I'll see you guys in September then, I
Okay.
suppose, right?
Yeah, good deal,
Yeah, good to
guys,
see you,
thank
man.
you. Okay,
Thank you, Mike.
yeah, thank you. Thank you, David.
Thank you.
And so, Penny, we have, currently 6 items on the agenda to talk about on resolutions, so you wanna walk us through that?
The first one is to actually approve the salt brine application that you did your public hearing on.
Okay, that's for BJ drilling,
That is
have a
correct.
motion for that,
Motion to approve.
Seconded.
and those in favor say aye.
Aye.
We have to approve the Knox County Treasurer Depository and Investment Income Report for May, which includes 95,249.48 interest income for the program income fund and the general interest income.
Big motion,
Motion to approve.
Second.
those in favor say aye.
Aye.
Utility permit from Lincoln Rural Electrification for Lower Fredericktown Amity Road between Dibelbus and North Liberty Roads, Pike Township.
Motion to approve.
Seconded.
Those in favor say aye.
Aye.
Utility permit from Lincoln Rural Electrification for Lower Fredericktown Amity Road, starting at 185-85 Lower Fredericktown Road and then going east for pole replacements in Pike Township.
Motion to approve.
Second.
Those in favor say aye.
Aye.
Have an agreement for bridge inspection services for the Knox County highways with John Wackerly Inspection. This includes 113 small bridges and 10 steel truss bridges.
Motion to approve.
I seconded.
And those in favor say aye.
Aye.
Have a memorandum of understanding with Knox County Department of JFS with Gabe's clothing retailer, and this is for the after, or not after school, but the back to school vouchers.
Is
Motion
Gabe's
to
up at,
approve.
Man, Ontario.
it's in Ontario.
There,
Yeah.
yes, motion to approve.
Second.
And those in favor say aye.
Aye.
So it's a Gabriel Brothers clothing retailer located in Ontario, and it's still there.
Great.
Thank you.
Have a packet of minutes and then the to bill list. Also,
Good, anything, Commissioner or see that you want to share with the board and the general public?
Well, just Knox County Health Planning Partnership meeting yesterday with Zach that was just here and about 20 other health partners in our community. And we discussed the communication efforts to inform both residents about services that are available to them. And there seems to always be a disconnect communication wise. We talked about reaching them from the lower level and bringing it up. but also the communication efforts among providers of services to better work together. And then making the communication more user-friendly to the residents and just helping get information. And they attend a lot of fairs and First Fridays and a lot of effort to do that, but it's been an ongoing conversation they've had for quite a long time. And so we're gonna tackle that and try to help the community understand that there's services available to them and they're in need. Different challenges people face in life that health partnerships, behavioral health can help. So we'll keep working on that.
Okay, thank
And
you.
also checking into Know Your Knox website, which we'll work on.
Barry, anything?
I attended the fair board meeting last night. They're getting geared up for the fair. Swine barn will be done within the next 2 weeks. They are under the impression that the Fairground Road will be paved by fair time. I told them I'd reach out to Brian Ball and ask that. So we'll see how that's
Yeah,
going.
and we'll see Cameron tomorrow. So
Yeah, because Cameron's actually doing the paving for the project.
Yeah.
Yeah.
I received a request to judge at the fair, but I said, I know I'd go with animals, but I can judge food.
I got that as well. I think we all.
Pie
did.
steaks.
Anything else?
I'm good, Joe. Thank you.
Okay.
Thank you.
Yeah, then yesterday I was at work dev meeting at the Kokosing Training Facility on the Mount Vernon Avenue in Freytown, and they were talking about one of the things they were talking about that there's several companies that are going to be laying off around us, but not necessarily in Knox County. And then I went to the Kokosing River Scenic meeting down at the Brown Family Environmental Center and standard, yeah, we're making sure that the river stays clean and monitoring different construction sites that will do anything negative towards our area. And then tomorrow, Cameron Keaton and Commissioner Lester and I will be going over to Morrow County to look at their engineer's new building. And that'll be kind of a all afternoon, all morning, I guess, thing scenario.
And we had an investment advisory meeting this morning and things are in good shape.
Yes, yeah. If there's nothing else, I'll take a motion to adjourn.
Motion to adjourn.
Second.
Okay, we stand adjourned this time. Everyone have a great weekend.